Hello, everybody, and welcome back to GHL's training resources. Today, we're going to be looking at EMR audit reports. It is no secret that privacy concerns and privacy specifically within the EMR has been a growing concern within not only our own clinics, but within the healthcare sector as a whole. And so these reports are necessary to be ran within each clinic to ensure that the EMR is being used effectively, appropriately, and efficiently within the clinic, as well as so we can stand behind the message that we advocate for patient and client privacy. We're going to look at two different types of audit reports today. We're going to look at transaction logs and we're going to look at system audit reports. So we're going to start with transaction logs. Our transaction logs are the click path that has been recorded from the moment you go into a patient or a client's file to the moment you go out of a patient's file. And so you can run this report by going to File, Utilities, View Transaction Log. You're going to set your transaction type to Patients. You're going to choose your date. I will go to beginning of this year. Your patient number, and search. You will be prompted to enter your password again. And then this is every transaction that for that specific patient within those date ranges. You'll see the transaction ID, again, confirming the patient number, the transaction date, the user initials, so this is the individual within your clinic who has gone into the chart, your piece type, and the IP address. If you click on each individual transaction, you will get your transaction details. One of the interesting pieces within here is the timestamp, so you'll be able to see when a user or a staff member of yours went into the file and when they left. So those are your transaction logs. The next, we're going to look at our system audit reports, and there are a handful of system audit reports that you are able to run. And so it's simply a matter of which one you are looking for based on the necessary audit report that you're trying to complete. So from reports, you will go down to audit, and you have this list of reports. Lack of use, frequent failed login audits, frequently accessed record audits, same patient last name search audit, username search audit, same user, same patient last name search audit, and your unmasking decision audit. Again, it depends on which one you're looking to complete. So let's start from the top. Lack of use. So your lack of use generates a list of users who are inactive within a specified period of time. Your frequent failed login audit. It generates the number of failed login attempts for each user within a specified period. Your frequently accessed record audit. It generates information about patients with records that were accessed several times within a specified period and the user or users who access those records. You're looking for records that have been accessed an abnormally high number of times, and you want to try to determine if that user had just cause for being in that record or in that file as many times as they were. Same patient, same last name search audit. It generates a list of users who have accessed charts of patients who have similar last names within a specified period. For example, John Johnson searched for patients Bob Smith, Jane Smith, and Mary Smith. Username search audit. Your username search audit generates a list of users who access their personal record within a specified period. It is worth noting that users who wish to access their own personal health records should only do so by following your clinic or your organization's privacy policies and procedures. Same user, same patient last name. So this generates a list of users who access the records of patients who have similar last names as them within a specified period, as well as the list of access patients. For example, the user John Johnson searched for patients. Bob Johnson, Jane Johnson, Mary Johnson. Some patients may have family relationships with the employees in the office or clinic, and we see this often within our own communities. However, just because a person is related to the patient does not mean that they have free access or authority to access a family member's health record. And then lastly, an unmasking decision audit. So this generates a list of users who overwrote privacy, or also known as breaking the glass, and accessed a specific patient's record, full patient or specific private notes, per se, within a specified period. So let's run one of our reports. Let's do username search. So you're going to choose your date. So I will go November 8th. And again, it breaks down all of the user name searches within that time period. We go again. Unmasking decision audit. You're going to choose when you're starting, when you're ending, and then your patient number. Lack of use. And again, you can choose whenever you'd like to start. And it gives you your results from your search. And from here, this is where you can dive a little deeper. You can go into each result. You can compare and contrast it to your transaction log and do your due diligence to ensure that any suspicious activity within the EMR is followed up on.